Medical Association and Ghana Registered Nurses and Midwife Association and partners deliberate on the fasting hesitancy in Ghana and some of the collaboration they can forge to improve and create demand for fasting uptake in Ghana. According to Ghana Registered Nurses and Midwife Association and Ghana Medical Association, in their notice on the recent increase on COVID-19 cases in Greater Accra, Eastern and Western region, which were about 1,064 cases, with 8 being severe and 1 critical. As of 20th June 2022, the active cases was about 1,255. Speaking at the event was the president of Ghana Medical Association, Dr. Frank Cerebor, said they are planning to transform about 2,000 health workers into vaccination champions by being able to gain their capacity in risk communication and community engagement to address the issues of misinformation in regards to COVID-19 vaccination in Ghana.
Booster doses. We see these developments as worrying, especially concerning health workers. This is because health workers, particularly doctors, nurses, and midwives, are not only on the front line of care, but remain the most trusted sources of information and access to vaccination. For this reason, the GMA, GRNMA, and the Health Promotion Division of the Ghana Health Service have come together with the aim of addressing hesitancy among healthcare workers and the general population. We plan to transform about 2,000 health workers into vaccination champions and build their capacity in risk communication and community engagement to address the issues of disinformation and misinformation regarding COVID-19 vaccination. We will also be collecting data on the reasons underpinning hesitancy among health workers to understand and address their concerns and misunderstandings that exist. And all stakeholders, especially traditional and religious leaders, youth groups, and the media, to encourage vaccine acceptance and uptake, particularly in districts with low uptake and people under 25 years. We must all support government to reach its target of vaccinating at least 22.9 million eligible Ghanaians in order to stem the spread of the novel coronavirus and prevent severe disease that it causes. While we work to increase vaccine uptake, we would like to reiterate that it is still important to follow the COVID-19 prevention protocols in the face of the recent surge of COVID-19 cases. When it comes to development of vaccines, in the past, you know that technology was not as it is now as of today. The technology is far advanced, and because of that, we are able to produce vaccines far better and faster than we used to. And so people are worried about long-term effects because the vaccine has not been in existence for a long time, and it didn't take too long for us to be able to come out with these vaccines. And so we do understand a little bit of it in terms of the reasons why people are hesitant, but we can't say we fully understand it, especially when it comes to health workers. And that's the reason why we need to gather at least some data to know exactly what their fears and apprehensions are, despite the fact that they are well knowledgeable when it comes to this vaccine, as we all know. The matter of us, they are taking the vaccine. And so from here, let me assure everybody that it has no effect on fertility. And taking the vaccine doesn't mean that you can't produce as many children as you want. As I stand here, I have taken, in fact, all my full 2 vaccines and even taken booster doses. And I'm sure that if I want to have children again, I am fully able to do that. So I don't think that it has any issues on vaccine, has not affected my potency. And so I think that we are just, there's an issue of this misinformation and disinformation that is going around that we all need to address. It's a safe vaccine, and we believe in it, and that is the reason why we are even on this trajectory. You will find even police who helps us in keeping the hospitals clean and making sure.
Also speaking at the event was the president of Ghana Registered Nurses and Midwives Association, Mrs. Papentua Fori Aponfo, encouraged Ghanaians on the use of face masks, observe social distancing and hand washing hygiene under the running water, and the use of hand sanitizer are very necessary. And she also encouraged government and private sector actors to continue to support citizens with these facilities at advantage points.
Isn't it? And there's need for us all to be concerned. And Ghana Medical Association, I indeed worry and wish to encourage Ghanaians on the use of face masks, the need to observe social distancing, GRNMA and GMA, and we wish to encourage all Ghanaians to use the face masks, observe social distancing, and maintain hand hygiene etiquette. And we want to state that the preventive protocols are still very necessary and vital in reducing COVID-19 infections among Ghanaians. And based on these, we wish to recommend to Ghanaians the following. It's important that we wear our face masks at all times, especially in enclosed spaces, such as offices, workplaces, schools, crowded places such as sports stadia, funerals, and cinemas. And we need managers and security officers in these areas, especially those who guard enclosed spaces, to put in measures to enforce these protocols. We all also need to wash our hands with soap and the running water, and this is key. One thing we noticed during the peak of the pandemic was that the washing of hands, indeed, aside preventing the COVID-19 infections, also reduced a lot of GIT problems, especially the diarrheal cases, and it's important that we continue to wash our hands. And we need government and private sector actors to continue to support citizens with these facilities at vantage points. We also need to use our hand sanitizers. Hand sanitizers, keep a cute one with you at all times and use them. And lastly, we encourage all eligible Ghanaians to be vaccinated. There's no need for hesitancy. We have lived with vaccines all these years. We have all at one point in our lives received a vaccine. And COVID-19 vaccines are no different. And it's quite worrying that we have our own health professionals who will take one vaccine or the other and refuse to take the next one or even the booster dose. My colleague, the GMA president, Dr. Frank Stribo, is going to expatiate on that. So on this note, I want to say thank you very much. And it's going to involve a lot of training. Alongside, we'll also be doing some research to understand data on health professionals. Thank you.